doing here?
I've had awful burning, tearing eyes all week. They're on fire, and there's nothing I can do to help them.
That kind of sounds like what I have. Last time I was here, I got diagnosed with something called dry eye syndrome. I don't know, it doesn't really make sense because my eyes are always tearing, but that's what they said I had.
That's so strange and it sounds awful. Dry eyes? You're only 24. How could that be possible?
I know. Actually, when I got diagnosed, I was looking it up in this thing called the Beaver Dam Offspring Study. It said that women get diagnosed with dry eye up to 17.9%, and if you're 20 to 49, you have a 14.1% chance of getting dry eye. It's crazy.
That sounds awful. Will it go away when I get older?
Actually, it gets worse with age, especially probably because of menopause, you know?
That sounds like I have nothing to look forward to.
It's also significantly higher, the dry eye syndrome, in women than men. So also, we have that to not look forward to. But to help, I actually started taking these pills. I wish I had them with me, but I don't. It's just a little pill bottle that I got over the counter. It's really awesome. The doc recommended it.
You know, wait, pills for your dry eye? Do they work for you?
Yeah, they're just like antioxidant pills, she said. Not really sure what they do, but you can ask the doctor when she comes and gets you.
Yeah, that sounds good. Are there any other vitamins I could take, I guess?
She mentioned something called omega-3, but I'm not really sure. She said it worked on inflammation or inflammatory process or something. I'm not really sure, but you should ask her when she comes and gets you. Definitely.
Yeah, that sounds good. I'll definitely ask her about that.
Hello, Ms. Patel.
Hi.
Hi, Dr. Desai. I'll be working with you today. How are you doing?
Good.
You can follow me back.
Okay.
How's your day been so far?
Pretty good. The traffic was horrible.
You can have a seat right here.
Okay.
So to start, I'm just going to be asking you a couple of questions.
Sure.
I see you're here today because your eyes are burning in red. How long has this been happening for?
So it's been like this the entire summer, and it's pretty bad. It gets worse when the heat's blasting in the winter, but the summer's been horrendous.
Are you doing anything to help?
Hi, I'm the second year intern. Do you mind if I scribe for you?
Oh, yeah. Go right ahead. The computer's right over there. It's okay. We have a second year that's going to observe.
Oh yeah. Okay, that's fine.
Hi.
Hi.
So yeah, do you do anything to help?
So I've used Visine to get the red out, and then my pharmacist mentioned these like Refresh Tears lubricant drops or something over the counter. I mean, they feel nice, but they don't solve any issues. My eyes are constantly burning, red, and they just feel gritty.
Okay. And it's in both eyes or only one?
Yeah, it's in both eyes and all the time. You have to do something to help, Doc.
All right, I'll do the best I can. Just a couple more questions before we
Okay.
get started. Do you wear contact lenses?
Yeah, I wear them when I go out, but it really, I wouldn't say hurts, but they're uncomfortable, so I wear my glasses more often than that.
Okay, are you on any medications?
Yeah, so I'm taking an inhaler sometimes, and it's for my asthma.
All right, so you have asthma and you take an inhaler. Do you have any allergies?
So my allergies act up during like the spring months into the summer. They've only started acting up around the past 2 to 3 years, but it happens often when I'm running, and then that's when I take them. But I don't use the inhaler often. It's just as needed.
Okay, and any other medications you're on?
So there's for my acne, there's Accutane,
Okay,
and I'm on birth control.
and any allergies to medications or allergies in general?
I get like the hay fever this time of year.
Okay, what are you doing to help the hay fever?
The hay fever and the congestion, and I use Claritin for that.
Okay, Claritin for the congestion. Got it. So do you smoke or drink?
No.
Okay, great. So, did you get everything? All right, awesome. So we can get started.
Okay.
So the first thing I'm going to do is just see how well you can see out into the distance. So I want you to take this and cover your right eye.
Okay.
And just read out there. What's the lowest line you can read?
It's just like going in and out.
You can blink.
Okay. It's like really fuzzy.
I'll take this from you. All right, perfect. Now I'm just going to see your eyes through this microscope. So you can take off your glasses, and if you can hit the lights for me. Just put your forehead against the glass and chin in the chin rest. debris on the lids and lashes. Open your eyes and look over here. Great. Cat my bowing glands inferiorly. Look down for me. Cat my bowing glands superiorly. Look up here. Grade 2 plus injection, 360. Okay, look straight ahead. Tear meniscus inadequate, 1 millimeter. And now if you can just close your eyes and open and don't blink. T-butt 2 seconds and diffuse staining 360. All right, you can sit back. So from what you've told me so far and what I'm seeing today in my findings, I'm seeing that you have something called dry eye syndrome. So some of the things that you're likely doing that are contributing to this are being on Accutane, taking your Claritin, even being on birth control.
Oh, wow.
And same with using your contact lenses.
Mm-hmm.
The Beaver Dam Offspring study actually reports that being under the age of 50 and being on birth control increases your odds of developing dry eye by 71%.
Oh, wow.
So the tears that are covering the front surface of your eye are actually evaporating a lot faster than it does for other people your age. So this is likely what's causing the burning, the redness, and even the watering.
Oh, no, really? But how could my eyes be watering if they're dry? What should I do, Doc?
Well, the good news is, don't be scared, there's a lot of options. I know you've tried the artificial tears, but there's actually another medication that we can start you on, which is called Restasis.
Oh, really? Okay. How does that work?
Restasis, or cyclosporin A, is a systemic immunosuppressive agent, FDA approved in topical emulsion formula for moderate to severe inflammation associated with dry eye. Shepard et al. Found that using loteprednol in conjunction with Restasis provides even more dry eye relief. Since Restasis takes about 4 to 8 weeks for maximal effects to show, adding loteprednol to the regimen provides faster relief of symptoms. Just 2 drops a day keeps the doctor away. It's so easy, even T-Rex can do it.
I'd rather not take any drugs. Is there anything else I could do? This girl outside that I'm friends with was talking about some antioxidants and some vitamins that she's taking. Should I use those instead?
Yeah, so actually the most common therapy for dry eye is the use of artificial tears, which we've already tried.
Yeah.
But that only provides temporary relief.
Mm-hmm.
So dietary supplements, like the girl in the waiting room is telling you about, actually can play a big role in the relief of your symptoms. The pill that your friend is on is probably something called oxybian.
Oh.
So this is a food supplement. It's commercially available, non-prescription.
Oh, okay.
And it has vitamin C, E, PP, B6. I know it all sounds like gibberish to you right now, but it's really good for you. In fact, a study by Holwatz et al. Showed that subjects on oxybian actually showed a significant improvement of their burning, itching, sensation that like something's in their eyes, the grittiness you were talking about,
Yeah.
and redness.
Okay.
So, and another thing is it actually increased their tear quality by 27.3% compared to only 3.61% of the people that were taking a placebo. So I highly suggest that you go to your local CVS, Duane Reade, and buy these supplements.
Okay, yeah, that sounds really great, but I don't like swallowing pills. Is there anything I could take that has these supplements in them?
That's a really good question because there actually is a lot of foods that we eat in
Oh.
our normal diet that actually have these nutrients and supplements. So I
Uh-huh.
have a list somewhere over here I can give you.
Okay.
Yeah, so take a look at this right here.
Oh, high in omega-3s. So it has like salmon and eggs and sardines, but I don't eat that stuff. And then flaxseed, olive oil. Yeah, I have it like pretty often. Avocados, almonds, walnuts, seeds. Yeah, that's I like that stuff.
Yeah, so you should try to incorporate those into your diet, but the most important thing is you have to make sure you're eating a well-balanced ratio of the omega-6s and the omega-3s, which I've listed there for you.
Okay, so the omega-6s are like vegetable oil, canola oil, sunflower oil, and some dairy products. Okay, I could incorporate those.
Yeah, and they're part of the polyunsaturated fatty acid group, so they're really good for you.
Okay.
I actually have 2 more studies here that if you want to read about on your free time, actually prove the same thing.
Oh, okay. Let me see. Oh, wow. So this says that 70% of the patients in the treating group became asymptomatic. That's amazing.
Yeah.
I'll definitely try to add these foods to my diet. And since I don't really want to take pills, it sounds good to me. What if I stop wearing contact lenses and get LASIK instead? Will that help?
Actually, LASIK will make it worse. I know it sounds really appealing to never have to wear your glasses ever again, but there's a study done and it showed that 28% of Asians actually experience chronic dry eye after their LASIK surgery for 6 months or longer. So I don't think it would be a right fit for LASIK.
I was really hoping to get LASIK, but I guess I need other options. So these drugs, these supplements, these nutrients in my diet, they seem great and they sound like they would work, but I just can't promise that I'd be that compliant with my busy schedule. So do you have any alternative treatment options?
Yeah, there's more. So one thing is called BlephX, and this could help remove some of the debris that I see that's in your lashes. Another option is moisture goggles, which basically are these like really cool looking goggles that you put over your eyes, and it creates a different environment for your eyes, so it increases the humidity and makes your eyes feel more comfortable.
Yeah.
Another option, which is pretty extreme, but since you asked, is called an amniotic membrane.
Oh.
So this is a thin membrane that fits over your eye like a contact lens, and it has anti-inflammatory properties, so this could help you feel more comfortable as well. This also stabilizes your tear film. And actually, lastly, a study by Kim et al. Shows that acupuncture can also relieve dry eye.
Oh, interesting. That's definitely an alternative. So this BlephX, it sounds really interesting, but I've never heard of it before. Is it anything like lid scrubs? I've heard of that.
Okay, good question. So BlephX is actually a device that spins a sterile microsponge along the edge of your eyelids, and it's used to remove the debris like I was saying before, and at the same time it exfoliates your eyelids. It's similar to lip scrubs, but it can't be used as a replacement. A good friend of mine actually was a co-founder of BlephX, and he has this commercial that he was just recently featured in. I show everyone, so I'm just going to show you too.
Yeah, okay.
Okay.
Hi, I am Dr. James Reinerson, and what we're going to do today is demonstrate a BlephX procedure on John. Here's our BlephX device and handpiece in its charging base. You want to make sure you have some lid scrub solution, a little alcohol wipe, your pack of BlephX tips, some numbing drops, and some balanced salt solution to rinse. So first, we'll hand the patient a tissue. And we'll instill 1 drop of numbing drops into both eyes. Tip your head back. While the numbing drops are setting up, we'll prepare the handpiece. First, you take an alcohol swab and you alcohol off the top of your charging device. Then dry. Then you apply a lid scrub solution. Several of these are commercially available. This is the time you would want to add a drop of tea tree oil if you're worried about treating Demodex. Remove the cap and prepare your tips. Now, when you peel these off, you will notice that the ends of the tips are exposed. You can ease them out gently just to facilitate loading onto the BlephX handpiece. So, before you load, place one finger so you may spin the chuck, and that'll help you to line it up because the chuck does have a double barrel opening to match up with the double barrel presentation of the tip. So you just put it against the BlephX base. You should just gently rotate until you find the correct alignment. You soak the foam tip, and now you're prepared to treat. What I like to do is after you've soaked it, soak it one more time just to make sure it's well prepared. Hold your button down for 2 seconds, but do it away from the patient so you don't splatter your lid care solution on their clothes. Now it's started. It's spinning in one direction now. Tip back, look up. So you have the patient look up. We're doing the bottom lid. And they're going to look down to the top lid. Now you want to go all the way across. And while you're scrubbing the lashes. You're scrubbing the edge of the lid posteriorly where the meibomian glands are so you can unroof those. Don't worry if you go inside the eye a little bit or you actually get inside the eyelid. You can see there it jumps in sometimes. That's absolutely no problem and does a good job of getting meibomian glands. Now with your finger placed on the button, you just simply push it again and it instantly reverses. So now you're getting the lashes from the other direction to make sure that there's nothing hiding along the base of the lashes from either direction. And you can just give a little swirling motion, a little side-to-side motion. If your patient's lids are a little lax, you can tighten them up a little bit. A little bit of a temporal pull on the lash, on the lid. And then you hit it again and stop.
Okay, that sounds good. But what happens if it doesn't work with my symptoms?
So if the condition worsens, which is very, very, very unlikely, a corneal transplant surgery is something that we can consider.
That is something that sounds so serious and really invasive and not somewhere I want to go. So there's something else that a friend has mentioned to me. I don't know if you've heard of it. It's called LipiFlow.
Mm-hmm.
I know she has dry eye, but I mean, I didn't even know dry eye was a real thing till today. So can you tell me anything else about it?
Yeah, of course. So LipiFlow is actually used to treat a different type of dry eye called meibomian gland dysfunction. And what it does is it combines lid warming and massaging of your eyes in order to free up some of the oils that are trapped in the glands that are along your eyelid. So this will lubricate your eyes. A study by Finnis et al. Actually showed that one 12-minute LipiFlow treatment is as efficient and effective as massaging your own lids 2 times a day for 3 months.
Okay. That sounds interesting. We discussed so many different treatment options today. I have a lot to think over. But just starting out, I think the BlephX sounded like the least invasive and something I think that would really help me starting out.
Yeah.
So what about if I start with that, and if that doesn't work to relieve my symptoms, we can try something else? Would that work?
Yeah. So one thing I do have to warn you about is that this treatment will not be covered by your insurance.
Okay.
So as long as you're okay with that, we can set you up with an appointment for next week to get started on your treatment. In the meantime, I do need you to continue using your artificial tears
Yeah, definitely.
and start doing lid scrubs like you had talked about before.
Okay, I can do that.
Good.
Mhm.
So do you have any questions before you go?
No, you're so thorough, Doc.
All right, well, you can follow me. And I'll
Okay.
walk you out.
All right.
Oh my god, Form, did I say something to make you cry?
Ashley, you don't understand. My eyes feel like they're on fire and they won't stop tearing.
Oh, not to interrupt, but it sounds like you have what I have. I have something called dry eye.
Actually, dry eye syndrome is very common and is becoming more prevalent. It's estimated that the number of people with dry eye syndrome around the world is increasing by about 3%. So you're not alone.
Oh.
more prevalent. It's estimated that the number of people with dry eye syndrome around the world is increasing by 3% each year.
Oh, no. That sounds like I have nothing to look forward to.
I know, right? When I got diagnosed, I looked it up, and this thing called the Beaver Dam Ulcer.
Oh, sick. But I guess I need other options.
The paper's too high, the router's covered.
I had something that I filled out called the dry eye questionnaire. Maybe they'll give it to you when you go back there. If you
Yeah,
pass your
I'll ask for
symptoms.
that. Okay, thanks.
Intern.
Actually, dry eye syndrome is common and is becoming more common. Approximately 30%